This is John Kanellopoulos. Very interesting case here I want to share with you from our office. This is a relatively young gentleman. He's in his 40s and came to us with extremely bad surface disease. He's using Ganfort and glaucoma. Let's go look at some details of his medical history. This is his eye in March. So this is 6 months ago. You can see this very significant deep vascularization and scarring in his left cornea. We can see how all the limbal area is quite affected, and how bad of a reflection. We're going to go look at the other eye here. Actually, this is the right eye. Before and after our treatment, we worked with autologous serum. We went to a preservative-free glaucoma drop, Ganfort, which is a combination of a prostaglandin and a beta blocker. And we can already see in the 6 months, besides him subjectively noting that he's much better, that the epithelium in the central area is improving dramatically. There's less gaps, you can see here at the limbal stem cell level, and the very large areas of blue of pathologic epithelium are improving. This is a very worrisome image of the right eye. Look how significant peripheral. This is a peripheral image with the OptoView Avanti OCT, and you can see how the cornea is thinning and how there's significant scarring and significant epithelial irregularity, which is now improved 6 months later. See how more healthy the epithelium looks. Very helpful maps here to help us with the active pathology. And this is the left eye, and the left eye I think illustrates very nicely the improvement from March to today on, again, I repeat, restasis, autologous serum, oral doxycycline, and switch from preserved glaucoma medications to unpreserved glaucoma medications. His pressures are very good. Again, this is the picture from today. We saw the left eye previously. You can see how the surface has improved dramatically. There's less stuff going on at the limbal, but we can appreciate the significant scarring that's here peripheral to the cornea. And we're going to see a similar picture with the right eye today. Again, nice reflection of light here. We still have a long way to go. We expect the restasis to start kicking in now after 6 months. We are going to continue for 6 months autologous serum, restasis, doxycycline now 100 milligrams every other day. Of course, we'll monitor liver function, and our pressure is excellent. He's at 14 millimeters of mercury in both eyes with 1 dose of Ganfort given at night. So again, going back to our patient, this is a challenging patient with significant anterior segment disease due to glaucoma medication. He has significant glaucoma. You can see on the ONH here the involvement and loss of optic nerve. This would have the corresponding visual field defects. This is the one eye, and here is the other eye. Much better in the left eye. So he is a patient that does require anti-glaucoma medication. Of course, with such significant external disease, these are the optic nerves here, showing again the better condition of the left optic nerve than the right, as we saw in the OCT, the beautiful OCT images by the Optos device. So the key thing here is how do we treat the glaucoma effectively and the external disease. An option would be a glaucoma surgery. But again, the thought process here is you want to improve the external disease first and then consider possible glaucoma treatment if the glaucoma is resilient to the minimal possible topical treatment that would maintain the surface of the eye in a better condition. And again, this is an eye that illustrates very nicely the helpful illustration by the anterior segment OCT. This is again the Avanti by OptoView 9mm maps, which, by the way, we cannot omit this, confirmed that this is also a patient with subtle keratoconus. This cornea thickness mapping, despite of the epithelial irregularity, is irregular, very typical to see in a patient whose family has a member with keratoconus, and of course something we're very astute in pointing out, especially in younger patients who may change, and in patients who are interested in laser vision correction. This was John Kanellopoulos. I thought I'd share this with you, and I hope you find this interesting. The difficult management of a patient who has severe external disease, possibly idiopathic, possibly exacerbated by topical medications used all these years for glaucoma, and continuing effective management of glaucoma. This is John signing out. Thank you.